Hi friends, do you think your teeth are not straight, you have crooked teeth, or do you think that you have an ugly smile? Don't worry, all these things can most probably be corrected with braces treatment. So what is a brace? So what are dental braces? This braces treatment is scientifically called orthodontic treatment. These actually use metal clips or braces which are attached onto your teeth, and these are used to correct the alignment of the teeth. So if you feel that your teeth is not straight, it is crooked, it is a bit outside, it is a bit inside, whatever you feel, these can most probably be corrected with your braces treatment. What is the ideal age for braces treatment? The general misconception is that the braces treatment should usually be done after 13 years of age. But the braces treatment is only used to correct your teeth. But how do you know that the problem is only with the teeth? The problem may also be in the jaw bone. It may be in the upper bone, it may be in the lower bone. Your bone may be forward, your lower bone may be backward or forward. So to correct these problems, it has to be done when the child is in a growing stage. So at 13 years of age, if you bring the child, most of these problems cannot be corrected, only the teeth can be corrected. So if you think that your child has a problem, it is better to take him to the dentist as early as possible, most probably ideally at 7 to 8 years of age. So what will happen if your child has a problem in the jaw bone, and if you do not take him to the dentist at the appropriate age, for example 7 to 8 years of age? So when the growth is completed, you can correct the teeth whatever you want. But if the bone is not in the proper position, then after the growth is completed, surgery is the only mode of treatment. Are X-rays needed for this treatment? So generally for the orthodontic treatment, to devise a proper treatment plan, 2 X-rays are needed. One is a full frontal view, that is your front view X-ray, and another is a side view X-ray. So these 2 X-rays are absolutely essential for devising a proper orthodontic treatment plan. So what are the types of braces? There are actually originally 3 different types of braces, and now another 4th type has come, which is the clear aligners. So we'll first see about the 3 first types of braces. So the first type is a metal braces, in which small metal brackets are placed onto your teeth, and they are connected by wires, and they pull your teeth backwards or forwards or whichever position it requires to be pulled. The second type are the self-ligating braces. These are also a type of metallic braces, but this is an advanced brace in which the treatment time will be very less. And the third type is the ceramic braces. So these are tooth-colored braces, and if you opt for these braces, the treatment done will not be very obviously visible to the outside persons. And the most recent type, as I said, are the clear aligners. These aligners are not actually braces, they are actually invisible splints which you can place onto your upper and lower teeth. And these can be removed by the patient itself only during eating. And these are invisible, and it's a bit expensive too. They are mostly preferred for adult patients and for patients who are going abroad, because the general orthodontic treatment requires monthly checkups compulsorily, whereas clear aligners need not be checked up every month. Maybe it can be postponed a little later. So these are ideal for adult patients and those who go abroad. Age limit for dental braces. As such, there is no age limit for dental braces, provided your teeth have a good bone support. But in our society and in our country, when a person crosses 35 to 40 years of age, and if he is having braces, a lot of questions will be asked by the outside world regarding the need for this treatment at this age. But in spite of all these questions, if you are convinced that you need this treatment, you can always opt for it, provided you have a good bone support. So what is the duration of this orthodontic or a braces treatment? Usually the braces treatment takes place around 1 to 1.5 years, in which you may be required to visit the dentist every month. And even after the treatment, post brace treatment, you may need a retainer treatment for 6 months to 1 year. So this is the treatment time for these braces. So if you have crooked teeth or if you have an improper smile, you can opt for braces and you can have a dazzling and beautiful smile. Thank you.